going to hand over to Sinead Delaney-Moretler, who's leader of a Strive partner in Johannesburg, the WITS Reproductive Health and HIV Institute, and she's going to chair and facilitate the session.
Welcome to all of you. For those of you who are not familiar with Strive, Strive is a DFID-funded research program consortium aimed at addressing the structural factors that drive HIV infection. And so we have partners in Johannesburg, the London School, KHPT in India, ICRW in India, and ICRW in the US, as well as several affiliates in those countries. And our work is primarily focused on understanding some of these underlying factors that drive HIV risk, but also more recently that perhaps influence uptake and use of biomedical interventions. So things like gender norms, gender-based violence, alcohol use, migration, mobility, transactional sex. And so it's great that we have Dr. Saugato Datta on the line today, who's going to be talking to us about behavioural economics and intervention design for development. I met Saugato recently at a meeting in Boston, which was looking at how behavioural economics can potentially help us in the field of HIV prevention. So it's great to be able to continue that conversation. Dr. Datta is Vice President at Ideas 24. He works with partners to design, test, and scale interventions that use behavioral economics to improve outcomes in programs that target poor people in developing countries. And he leads Ideas 42's work in the developing world. Dr. Datta has been an economics correspondent for The Economist, a researcher at the World Bank, and he's worked in international development broadly and has a wide range of experience working on intimate partner violence, reproductive health, age-disparate sex, but also in other development fields like energy and water use. He has a PhD from MIT, and I think we all look forward to hearing his session. So over to you, Saugato.
Good morning, everyone, and thank you, Sinead, for that lovely introduction. I hope everyone can hear me well. So as Sinead said, I'm going to be talking today about behavioral economics and intervention design for development. And really, the idea is to give an overview of what behavioral economics is, why it matters for program and policy design, particularly in developing countries. And then I'll go through some basic behavioral economics insights and some common design tools, and then try to explain what we do at Ideas 42 in terms of trying to apply these tools to important problems. And then we'll talk about a bunch of applications to health. And then I'll end with a little bit of what I like to call a cautionary tale, which is really about how all of this is and sounds very exciting. It is very exciting, but it's also difficult, and sort of knowing what tools to use when and what problems to solve using what tools is trickier than it might first appear. So with that, I'll dive right in. And you see on your screen a picture that it's a very funny picture, but one which in some ways I think really captures what this field is really about. And the reason that it captures that is that it sort of shows you that when we see people do something, and this could be true in sort of, serious policy context, but it's also true of each of our day-to-day lives, it's very hard to know what exactly it is that they're intending to do and what sort of thought process is behind it. And this picture sort of shows you people, and, it shows you people going into a gym, so they apparently want to exercise, but also shows these people using an escalator. And it makes you wonder, whether they really do want to exercise and to what extent, and how much, if you see someone using an escalator, what would you think about them in terms of their desire to exercise? But then if you expand the picture and see that they're actually going into a gym, then it sort of messes up your initial intuition. And I think what we want to take away from this is really the idea that context is very important in any decision and any action, and in interpreting what it is that people want to do and what they're doing. And I'd like to us to keep this in mind. And really, that's sort of at the core of what we do as applied behavioral economists. We recognize the importance of context and the ways in which context influences behavior, and then behavior in turn influences context. And so all of these things are, as you'll see, sort of, fairly complex and not that easy to disentangle. But over and over again, we'll return to this idea that it's hard to know exactly what people intend to do by seeing what they do, and context and very small features of context and situations that people are in influence what they do and how they behave in surprisingly large ways. And so what we do at Ideas 42, or as what behavioral economists, sort of applied behavioral economists really do a lot of, is thinking about the context in which a person makes decisions or takes actions, and then learning more about this context through qualitative and quantitative work, through observation, and so on. And this allows us to see programs, whether in developing countries or elsewhere, through the eyes of those who experience them. So I'll talk about this process a bit more as we go through this presentation. But first, I wanted to give a very, very brief introduction to behavioral economics and its view of decision-making. Behavioral economics is really a discipline that's emerged from the melding of a number of different disciplines. There's economics in the title, so there's a sort of, modeling of human behavior component to it. But there's a lot of psychology that has sort of fed into it. And I think of it really as the combination of insights from a number of different disciplines. And, there are, of course, this is a large field, there are many things we could be talking about in terms of what this field means and implies. But I think the key thing that, is helpful to begin with is thinking about how this view of decision-making, of human decision-making, differs from a more standard view. And the standard view is a sort of, that I have up on the slide, is sort of a cartoon version of a neoclassical economist view of the world, which is very sort of cut and dried. It says, there are costs and benefits to anything that we do. If benefits exceeds costs, then we do them, right? So we decide to do something, and then we decide based on whether the benefit exceeds the cost, and if we've decided to do something, we then do it. This leads us to an outcome. And I'm saying this is neoclassical economics, and it is, because this cost-benefit calculus is at the heart of that. But this is also very intuitively appealing. I mean, it sort of makes sense to everyone that when you see somebody do something, you assume that they are probably doing it because, they think it gives them, it benefits them in some ways. It's beneficial to them. And I think, really, so this is economics, but this is also the way we often intuitively think about human behavior. And particularly keep in mind that when we see somebody not do something, we then also make the corresponding assumption, or we make the corresponding inference, which is, they probably weren't getting enough benefit from doing it. And I think this is very intuitively appealing. But what behavioral economics does, because of all the research that's been done in psychology about decision-making, is really complicates this whole process. And it says, well, it's not so obvious that decisions happen at all. So there are many, many situations in which decisions are never actually made. So nobody actually decided one way or the other to do something or not to do something. And when they are made, these decisions may not depend just on this kind of evaluation of costs and benefits. There are a whole lot of other things that come into play. So people may weight the present disproportionately highly. They may respond to social cues in ways that seem economically non-rational, but make perfect sense to the individual. And a number of then sort of other psychological phenomena come into play to explain also why this process of moving from a decision, if it is made, to an action is also complicated. Because as you try to implement whatever decision you've made, you may find that, in some cases your decision changes. So you find that the process actually changes your original decision. Or there is scope for procrastinating, there's scope for deferral, there's scope for just not doing something. So all of this is just a whole lot messier than that first simple picture that I showed you. And so what does this mean? And I've sort of been hinting at this over and over again. What this sort of tells us is that, very basic thing that it tells us is that actions do not necessarily reveal intentions. Sort of seems obvious when I say it that way, but as we'll see over and over again, this is not an assumption or an inference that I sort of switch between assumption and inference, where really I should be saying one or the other, but this is not something that we typically tend to think is going on. And I'm showing you a very kind of simplified version of the results from a study that JPAL did in Rajasthan in India, where they were trying to understand, how to get immunization rates up among poor people. And you can see that in controlled villages, barely 6% of kids were immunized. And when they added camps, they tripled that, but then they added a tiny incentive in the form of a bag of lentils and a metal plate. And this doubled the immunization again from that original tripling. So it sort of goes from 6% to 36 or 37%. But for a moment, let's not focus on the magnitude of this result, but what it tells us. And what it tells us, I think, is that with our neoclassical glasses on, we would have thought that 94% of parents either didn't want their children immunized or that they lacked easy access. Yet, in fact, a small nudge got an additional 18% of parents to get their children immunized. So we can debate the details of this nudge and whether it's a good idea or not, but what it's just telling us that approximately 1 in 5 parents looked like they had no interest in immunization. They didn't even bring their children to be immunized when they were regular immunization camps. And yet, their decision was very easy to change, and they actually acted on it. And so, the intentions were not as clear-cut as they first revealed. So, at least for some people, actions don't necessarily reveal intentions. And of course, we very rarely know what people intend to do, but here's an example. This is from Duflo, Kramer, and Robinson in their study of a fertilizer use in Kenya. When they asked this question, they found that you can actually, in some cases, very clearly see there's this gap between intention and action. Here are virtually all farmers saying that they intend to use fertilizer, and then very few of them, so about a third of them, actually followed through. So follow-through is very, very low. And this is something, we rarely ask these questions, but when we do, we see these kinds of gaps everywhere. And of course you might say, should we believe what farmers say, or should we believe what people say? And the answer is, of course we shouldn't completely think that everybody is telling the truth and they may be telling us what we want to hear. But these gaps are so big that it suggests that there's something going on here. There's at least a significant fraction of people for whom there is an intention that is not being acted on. And so I think that at its core, what behavioral economics does is that it provides us with a set of insights about why intentions and actions diverge. It also helps us understand how motivation works and how intentions are formed, but I think the real power of it in terms of intervention design is in this gap. And I have on this slide sort of, a bunch of pictures that are meant to show you some ways in, some of these sort of central concepts that help us understand why intentions and actions diverge. And they are things like limited self-control, perceived social norms, the limits of our attention. All of these things help to explain why these kinds of things take place. And, one can talk about, sort of seemingly trivial things like going to the gym, but, as I'm trying to show you on this slide, what researchers have found over and over again is that it doesn't just influence these kind of simple, seemingly trivial behaviors, but really important things. So when you're trying to understand why input use is low on some farms, this framework proves to be very helpful. When you're trying to understand why a lot of people, despite the huge amounts of effort that go into providing access, cheap access to medication, why is adherence to medication often so low? Again, this framework and this discipline proves very, very useful. And we could go on. And this understanding leads us to certain kinds of design ideas, and so there are a number of tools, and I sort of, playing with the word tools here, but these are sort of things that can be incorporated into program design. So we've seen a couple of examples, and we're going to see some more of these tools and how they tackle different things. So going back to, Duflo, Kramer, and Robinson's study about fertilizer use, what they found was that home delivery, which was sort of equivalent to a 10% discount on the market price, led to a huge increase in usage. And I think the important takeaway here is not the sort of detail of this particular intervention, but just the idea that once you start thinking about this decision-making process in greater detail, once you start to begin to understand that actually it's not that people don't want to use fertilizer or that they can't even afford it, but that they can't afford it at the time when they need to because they procrastinated for too long. You can think about details like the timing of a subsidy and not just how much. So typically you can think endlessly about how large a subsidy should be, but what behavioral economics often does is helps you think about a different aspect of it. So in this case, it says, when should the subsidy be delivered? And it turns out you can use a much smaller subsidy to get the same effect if you play with the timing. So here's another design idea. Inattention turns out to be enormously important in determining what people don't do, and correspondingly, reminders turned out to be, sort of just much more important or much more effective than you would expect. And then you can think, and what behavioral economics gives you is a way of thinking about not only should one use a reminder. So this was a study where they were using reminders to get people to save more. So these are people who've said they want to save, and all that was being done was a text message which said, remember you said you were going to put some money in your savings account, did you? But then they realized that, you could actually frame the message in a different way, which made it even more effective. So you could actually say, you said you were saving for a motorcycle, did you do it? And that actually bumps up saving, a lot compared to just giving a basic message. So it gives you a number of ideas about not just when to use these interventions, but how to use them. And finally, here's another example of the input use problem being tackled where, again, the issue was that there are problems in terms of hanging on to cash for long enough to have it available to pay for inputs for the next season, and a commitment product, so a savings account, which allows you to voluntarily lock in your savings for some period of time, proves to be extremely helpful. And, maybe in questions we can talk more about why and how this works, because this is quite interesting, because it also has to do with a lot of social stuff and community norms and things like that. So how do we arrive at useful interventions? Well, at Ideas 42, the name comes from Douglas Adams' book, Hitchhiker's Guide to the Galaxy, and, in that you're supposed, he says this thing about asking the right questions, and we do really think this is very important. And, over and over what I've been saying is that often we don't ask certain kinds of questions. We don't ask people what their original intentions were, so we try to impute them from what we see. And what this whole discipline is telling us is that that can sometimes be misleading. So it's important to ask these questions, but really it's important to think carefully about what the problem is you're trying to solve, then really use what we know from the science and from the research to inform our diagnoses, so our understanding of what could be going on, and this leads to ideas about what kind of intervention to design. And then obviously in an ideal world, one would like to test these interventions, perhaps using a randomized controlled trial to see whether there is impact in the way that one expects. And so, but the thing to sort of take away is that this diagnosis phase, which comes between sort of defining what the problem is and actually designing an intervention, is incredibly, incredibly important. Here's an example of how we applied this to the problem of age-disparate sex in South Africa. The basic problem here is that there's this sort of age HIV prevalence curve, which means that a teenage girl, for instance, having a sexual relationship with an older man is actually really risky. It's riskier than having a similar relationship with somebody her own age. Of course, there are also other factors complicating it, including negotiations around condom use and all this other stuff. But really, one of the interesting things we found was that there are a number of things going on. But one thing that's happening is that young women think that older men are actually safer than younger men. And so we decided to design an intervention based on this, which would really try to reframe these HIV risks by very simply, in a kind of gamified format, informing young people about the way that risk varied with age. And this proved to be and this was a very small lab experiment. We were working with at-risk, low-income teenage youth in the Western Cape. And what we found is that compared with somebody who read in the control group a very standard few pages of text about HIV and how it was spread and the age dimension, there was much greater understanding at the end of this of the way in which HIV risk varied with age among the treatment population who were actually playing this game, where they were being asked to guess repeatedly whichever pair of people was more likely to have HIV, and they were being given feedback about their responses. Here now is another sort of interesting example, I think. This is ongoing work by Frank Schilbach, who is a finishing doctoral student at Harvard and who is affiliated with IDS 42. And what Frank is looking at is rickshaw pullers in India, in Chennai. And, as you can see, these are, they work really hard, they don't make very much money, and they drink a lot. So there's a lot of alcohol being consumed. Interestingly, a lot of them say they would like to be drinking less. And, should we take this as face value? And this is the classic example of something where, people, if you ask them, are probably all going to say, I wish I drank less. But what Frank is finding is that, he's trying to test whether, is this just social desirability? Is this just that people are saying what they think society wants them to say? Or is there really a self-control problem that people recognize and that they are willing in some ways to pay to solve? And that's what this is very preliminary, so he doesn't have full results yet. But what he's finding is that there is this demand for a commitment product. So you could so these are people coming back repeatedly for breathalyzer tests, and you can either take a financial incentive to show up sober, so this is money that you get only if you pass the breathalyzer test when you show up, or you can just take an unconditional payment. And people are willing to take the conditional payment. In other words, they're willing to forego some money for sobriety, even when the unconditional payment is actually larger. So imagine you're offering somebody 100 rupees unconditionally, or you're saying, if you show up sober, we'll give you 80 rupees. And they're choosing to take the 80 over the 100 because they're finding that it helps them to stay sober. And so this is, I think, really fantastic and really interesting, because what Frank is showing us is this sort of something that really seems like people probably just want to be drinking what they're drinking. They're willing to take steps, and they're willing to sort of use these kinds of products to help themselves stay sober. Couple of quick further examples. So this is actually from the US. It's not from a developing country, but I think it's really, really interesting, because this is showing us that even when people say are intending to do something like get a flu shot, get a vaccine shot for the flu, having them think concretely about when and how they're going to do that is really effective and increasing their actual uptake of this. So, some people are just being provided the service. Others are being asked, why don't you write down when you're going to go to the clinic and how you're going to get there? And that actually bumps up the rate of usage or the rate of uptake of this enormously. And then here is some work by Rebecca Thornton, which again I think is really interesting. So this is looking at the problem of people who don't come back to actually pick up their HIV results. So they get tested, and then they never come back to pick up their results. And what she was testing was, could you get over this with a small financial incentive? And the sum along the bottom is dollars, right? So the zero is if you don't give an incentive. And then what you see is, I think that the important thing for me from this study is not that the incentives work, but the fact that the smallest incentive actually is almost as powerful as a much larger one. So you don't need very much. You don't need to turn this into a big thing, but a small nudge. So again, this is a little bit like that lentil plate study, a small incentive. And it doesn't have to be money necessarily, and one could experiment with other forms of doing this. Just something that tips you over from inaction to action can be really effective. So finally, here's my cautionary tale that I said I would talk about in the beginning. I don't know how many of you are familiar with this, but there is, in the United States, there are these things called 401k plans. And this is the primary form of retirement savings. So people contribute, these are contributory pension plans essentially, where you contribute a certain amount, often your employer matches it to a certain, up to a certain point, and this money builds up and so on. And, there have been about 20 or 25 years of trying to get people to enroll in these plans, because what tends to happen is you find that people have worked for 10, 15, 20 years and they've never signed up for their 401k, and then, they get close to retirement and they have no money, right? And so what turned out to be dramatically effective here was actually just changing whether you had to actively sign up to one where you made it a passive decision. So what they started doing was, this was one of the early experiments in applying behavioral economics at scale, was what they found was that what was getting in the way were things like inattention and procrastination rather than a disinterest in saving. And so what the people involved, it was Bridget Madrian at Harvard and Daniel Scheer, what they did was they said, well, how about if we flip it? So we say to everyone, you're already enrolled as soon as you join the company, but if you want to unenroll, if you don't want to participate, why don't you sign this form and submit it? And this dramatically increases enrollment, and in other studies you see that it increases savings over a period of a person's life. So then, this sounds really interesting, this sounds really wonderful. Why don't we take this idea of changing the default option, changing what happens if you do nothing, to another saving setting? And so the Earned Income Tax Credit is a tax credit that low-income people get. So it's a big tax refund that you get from the government at tax time in the United States. And so a bunch of economists thought that they would actually default some of these people into saving some of that money rather than spending it, so put it into a savings bond. And they tried these two tweaks, right? So they said some of them would have to opt in, some of them would have to opt out. And they found absolutely no difference. And I think this is really telling, because what it's saying is, here was this intervention that worked beautifully in one context, which was retirement savings, but didn't work at all in this other context. And I think this is a cautionary tale, because what it tells you is you need to be asking questions that tell you whether your intended intervention is appropriate. And in the case of retirement savings, it was appropriate, because as you see from this slide, there was a lot of interest in saving more, but there was very little follow-through, right? So a lot of people, 68% of people were saying we'd like to save more, but almost nobody, so the 3% of people were actually following through. So this is a setting where giving people a way to follow through on their intention ought to be very powerful, which is why the default change works so well. But here is the corresponding thing about the EITC refund, which was done ex post as a way of understanding why it didn't work. And there it turns out that, these are poor people who don't have a lot of disposable cash. And so they have been looking forward to this tax refund all year, and they have very clear plans on how they want to spend it. So they do not want to save it. They actually want to spend it, because that's when they're going to buy the things that they need. And so what happens is you take this intervention that worked really well in a different setting where the intention to save was present, and then you put it into a setting where there was no such intention, and, sort of surprise, surprise, it doesn't really work, right? And so I think that is what I'll end with at this point, to say it's really important to understand what the intervention ought to be, what's actually going on. This is what we call diagnosing the bottlenecks, understanding what's really getting in the way, what do people want, what are their ideas about how to achieve these things, and then thinking about what the intervention could be. So on that note, I'll pause, and here are my contact details, but I'm looking forward now to a discussion. Thank you.
Thanks very much, Saugato. That's a great presentation, and I think gives us a good overview of behavioral economics. And I think that the STRIVE Consortium are very interested in the role that cash can play in sort of responding to some of the kind of barriers to uptake and use of HIV prevention. But what is your response to the naysayers who may feel that giving people incentives removes their internal motivation, or who feel uncomfortable with the idea that you're paying people to adopt behaviors?
I think that is sort of the fundamental tension with using cash in these contexts. And I think it's an important one. I do think, though, that it seems to vary a lot from situation to situation. So, particularly important may be dimensions about whether it's a one-time behavior that has long-term effects, or whether it's recurring behavior. And I think one needs to sort of think about motivation in different ways for those settings. But also, one probably what this science sort of tells us is, A, that one should think about incentives more broadly than just cash. And there are other kinds of incentives that can be just as powerful. So that's something that one should always keep in mind. So I think we tend to default to cash because it is often sort of the easiest and the most fungible and, a really good way to provide these incentives, but we shouldn't rule out thinking about other incentives as well. But the other thing I would say is that when it comes to kind of longer term sort of recurring behaviors, things that you want people to adopt, one of the important ways to think about incentives is not so much as something you want to be doing forever, but as something which helps you begin that process of habit formation. I mean, in the end, it's much more powerful for people to, as I think the naysayers would say, have these motivations and act on them sort of internally rather than needing this external push. But the question is, how do you get people started on that path? And that is perhaps where I think things like incentives, things like cash can be very important. I do have another thought on that, which is, I have found in my discussions that ideas around incentivizing behavior seem to be thought to be much more problematic when it comes to poor people, and not so much when these incentives are sort of built into systems that apply to sort of, for want of a better phrase, people like us, which I think applies to most people who are listening to this webinar. And I think that is something that we need to really kind of think about and in some ways push back against. And I'm reminded always of, I'm sure many of you have read Esther Duflo and Abhijit Banerjee's book, Poor Economics. If you haven't, I recommend it very highly. And, one of the points, they did this sort of immunization study with the Lenten plates, which came up with exactly this. People really objected to this, saying, people should be getting their kids immunized. Why do we have to give them a little incentive? Why even, we understand it's small, it's not a big deal, why do we have to give this to them? Why can't they just come? And what Esther often sort of talks about in this context is that for, middle-class people in the United States or in other developed countries, a whole host of things are available already nudging you along the path to having your child immunized. The school system is set up for it. Things are done for you. I mean, they may not be direct cash incentives, but things are done very much, they're already set up to sort of make it as easy as possible for you. Whereas in this setting in rural India, we're expecting these people to show up in sort of 40-degree heat and wait for hours with their children in line and get themselves immunized. And we're actually asking them to incur a pretty large cost. And so, should we really be that upset if we give them, whether we call it an incentive or a token of appreciation or something to slightly take the edge of what we're asking them to do? I think those are things. So I think, I do think it is important to think about how motivation is made and sustained in the long run, but I don't think the distinction between cash and no cash is as cut and dried as it's made out to be.
We have a question here in Johannesburg.
Okay. Hi, this is Deborah Barron. I thought that your comments around generic reminders versus goal-specific reminders was very interesting. And I just wanted to ask in relationship to our work here is clinical trials, and specifically we're doing a lot of biomedical prevention studies. And so one thing that we've kind of grappled with is moving away from sort of prescriptive reminders to more aspirational messages and sort of using those reminders, but maybe not goal specific, but more around sort of positive aspirational, undertaking that positive behavior and adhering to the protocol more to benefit these positive social norms we're trying to create around the study. So I'm just wondering if you could speak a bit to that, and especially if there are any studies that have looked at using sort of those different types of nudges, sort of what benefits the individual versus using nudges that push people toward just, greater positive social norms, and if people do respond to those.
Sure. So, the example that I talked about was a specific study which was, looking at a number of ways to frame this reminder, but more broadly, I think what you're talking about is very much within the range of things that people are experimenting with. In other words, what should one could call it a reminder, one could call it a message, and this could happen at various points in the cycle of, decision making and action. How should these be framed, and what's the most effective way to frame things? And there's a host of stuff actually around this, and in all sorts of areas that it would be hard for me to summarize in a few sentences. But let me think of the ones that I think might be interesting to you. So there's a number of ways in which people have tried to frame sort of goals of doing something. So, you could think about there's something that you want people to do. So it could be, adhering to medication, or it could be adhering to a protocol. And it's really useful and interesting, I think, to go into this and think about what is actually holding the process up. So is it really that people are forgetting? That could be one thing. Is it that they're not remembering at the right time, right? Is it that they're sort of, they're on board with it, but they're sort of not really internalized or thought about why they're doing what they're doing or meant to be doing, right? And all of these sort of doing some qualitative work around that really helps to understand what should this message framing be. And what I will say is that definitely there are things that are being tried and that should be tried around, the aspirations piece, around thinking about what the what the goal of an activity is, what the social benefits of it are. But also these things work in really odd ways. So there is some forthcoming work that I saw presented recently at a conference that JPAL organized. This is by Nava Ashraf at the Harvard Business School, who works a lot with the government of Zambia. And I bring this up because I thought this study was fascinating, because what they were trying to do was they were trying to see whether they could get, they could basically get improved performance from government hired nurses who have to go out and do a whole lot of, home visits and, stuff that is quite sort of taxing and strenuous and that people don't really end up doing as much as they're meant to be doing. And they experimented with two ways of motivating these people in terms of what their job was about. And one was sort of bog standard, and the next one was, really motivating the social aspect of this. So you're doing this for the community. This is what's going to help improve the health of people in your community. And that had some pretty good effects. But what really worked, strangely, was actually making people think about their own future career paths and sort of seeing this as doing this work is really going to help you progress. And, there are things further down the line with more responsibility that you could aspire to. And so, so it's not always obvious exactly which framing is going to work, and I think that's where experimentation is needed and important, because I could give you a guess in any given setting about which framing is going to work better, and I'm almost certain that I would be wrong if I hadn't actually spent time trying to really dig into the context. But absolutely, there's a sort of a range of things around the way that messages can be framed which tap into these ideas of social belonging, aspirations, long-term goals, short-term goals, altruism. I mean, all of this is fair game, and I think is really, really interesting and should be explored more. So I'd love to also know more about the work that you're doing, because it sounds fantastic.
Hi, my name is Sue Kelly. I'm here with the team in Wanza, and thank you for your presentation. We've had a lot of discussion here in Wanza. Maybe two things. First, I was wondering what the link between this nudge or economics and social marketing might be, and also we're discussing here about how the use of this strategy in resource-limited settings, and that if you incentivize maybe intervention X, and when those incentives stop and the new intervention Y with other incentives come, will people jump from one to the next because they're chasing the incentives versus the actual benefit from those incentives?
So let me answer your second bit first, and then I'll ask you to repeat your first bit, because as I was listening, I've forgotten what it is. I apologize. So about the incentives. I mean, I think, again, the thing that I want to really emphasize is that we do focus a lot when we think of economics and then we think of behavioral economics on incentives, but really one of the big ways in which behavioral economics sort of really deviates from standard economics is to say, standard economics really has sort of one instrument, which is prices, and it tries to move prices around in different ways. And it does that by subsidizing, it does that by incentivizing, it does that by, all of that sort of stuff. And I think one of the lessons of behavioral economics is that prices are by no means the only instrument. And therefore, financial incentives are by no means the only things we should be thinking about. There are a lot of other things within programs which don't appear like incentives to the person. And, those could be things like social recognition or, or peer recognition or, the feeling of having contributed to something. But these are all very, very important things that we should be exploring as well. I do think that you're absolutely right to be thinking, if we incentivize behavior X for this program, then we come along and incentivize behavior Y, won't people sort of switch from X to Y? And I think that that's a real concern, which is in some ways why I think in the longer run you want to use incentives at best as a sort of gateway into something and then, ease them out in a way that that sort of, habit formation takes over rather than needing the incentive. And this applies also to other kinds of, so it doesn't not just financial incentives. I think one of the interesting things is that many things, any of this kind of feedback stuff, for instance, where you're getting constant feedback on your performance, initially it acts as a sort of, motivational spur, but over time what it does is it sort of leads to habit formation, and that's what you want to be aiming at, I think. So I would just say think about incentives broadly. Don't think just about financial incentives, and think really long and hard about these questions and whether you want to taper incentives off, whether you want to, how is one program going to interact with the next. I don't have like a, one-word answer that's gonna sort of answer that. And actually, I remember the first part of your question as I was saying this, which was about the links with social marketing. And I think that so I would say social marketing, behavior change communication, and the sort of nudge approach that we're talking about all have overlaps. The difference probably to me, what's most striking, is that the marketing and communications approaches are very much about trying to change motivation. That's sort of the key goal, is to sort of get people to want to do something. And I think the core of the nudge approach is the recognition that there are definitely important situations where you want to change what people want, but there's a lot of untapped potential in actually getting people to do things that they already want to do. So we are not trying to change what they want. You're not trying to change their motivations. You're not trying to change their desires. What you're doing is trying to provide ways in which they can follow through. So I think that's the stuff that I think social marketing and behavior change communication doesn't do as much, and that's where I think the meat of what this kind of more nudgy approach lies. And that I think, this is going back to the way we think about what people want to do. And I think we don't think enough about what people want to do. We tend to assume that if they're not doing something, they don't want to do it. And just over and over again, we find that they might actually. And so if they do already want to do it, we don't want to spend a lot of time or effort or money or, sort of program resources convincing them, and that can actually be quite expensive, but rather thinking about what are the things that are standing in the way of this desire to do something or this sort of half-formed intention to do something being translated into that something being done. And that's where you can start thinking about little tweaks to the way things are framed. You can think about little tweaks to the way people get feedback on what they're doing. You can think about reminders. You can think about ways for them to commit themselves in advance, ways for them to make concrete plans, all of this. And just by the way, all of these ones that I mentioned don't involve money at all necessarily. They involve other things. They involve money in that whatever you're doing will cost something to do, but they don't involve giving money to the person. And so I think there's just there's a whole range of stuff that one could be thinking about.
Thanks, Saugato. I've seen Joanna Herat has raised her hand, and after that, Val Curtis has a question. So I'll take those next two questions.
Thank you, and that was a really excellent presentation. thinking about the nudges that are needed. I've been very interested from my side here. I'm in at UNESCO working on HIV and education, and we've been looking quite a bit at the intersection of cash transfers and their relevance for girls' access to education, as well as the impact that they're having on uptake of HIV services and the impact possibly on HIV prevention. One of the questions that's been coming to my mind is what do we know about the long-term efficacy of incentives and I guess specifically cash transfers, because obviously they're getting a lot more traction now in the HIV response, and I kind of sense an innate concern that we know what they can do in the fairly short term, and I think I think there's quite a robust debate going on with some people saying that they're a useful springboard to initiate change that can then be supported by longer term interventions if you're looking, for example, at issues around gender inequality. But I don't know that we really have any evidence for the longer term, so I wanted to ask what we know about that. Do they become less effective as time goes on, as they've been going on for longer within communities, and what can we learn from any experiences that have been more long-standing?
That's a great question, and I think actually, to my mind, if there's one thing that the field really needs to now focus on, having done the sort of first wave of stuff where you're showing that some of these things are effective, is really thinking about these long-term issues. My gut is that, they are more useful as a sort of a springboard and, a gateway into habit formation rather than something that you want to keep going forever, and that's also just from a sort of a policy sustainability point of view. But I will say that I don't think that thinking just to sort of, a lot of this evidence is based on this wave of randomized controlled trials. Things just haven't been going on for long enough for these sort of, what are the long-term effects? Both sort of does the effect of this wear out over time, but also what does this do to these questions of sort of intrinsic motivation and overall, what are the general equilibrium effects over time? I think these things just haven't been addressed yet. There are studies going on that are going to try and address these, but, I think it'll be a while before we know what the results are. When it comes to things like incentives, again, I think if we're thinking about repeated long-term behaviors, we do need to think about more than just like that initial incentive, because we can't keep that going forever, even if it were to be effective, which I doubt. Because we know from other sort of contexts that, essentially, just as habit formation helps you do things over and over again, you also get habituated to any of these kinds of things. So they're all very sort of novel, but they're effective when they're novel, but tend not to be. So yes. So I think that there isn't any good evidence, whether on kind of transfers for these kinds of things, or cash payments, or indeed any of the other kinds of nudge work. Even if you think of something like reminders, like at what point do people get habituated to it and then it stops having an effect altogether? I would love to see more work on this. What we do know on the more encouraging side is that when it comes to cash transfers for other kinds of behaviors, for example, if you look at CCTs, those have now been tracked for a considerable length of time, and they seem to continue to be effective. But that still leaves open the question of how sustainable they are and whether they, is it feasible to sort of keep this kind of, payment-based thing going forever? And I think there I would just say that it's very, very nascent at this point, but there is some interesting work going on about looking even at whether you need, for example, the conditionality in a CCT. Should you be explicitly making things conditional, or are there actually nudges that can replace the conditions? And there's a sort of interesting background to this as well, which is that, over and over again now, what the new research on sort of scarcity and cognitive load is finding is that this sort of stuff, like, program conditions and so forth, impose a lot of cognitive load. And if you look at, I'm going to get the names wrong, but there's a group of people from the World Bank who've been doing this work around conditional and unconditional transfers in, I think it's in Malawi, and these are teenage girls. And, what they're finding is some really suggestive evidence that when you impose conditions as part of a cash transfer program, you're likely to, you have that getting what you pay for problem. So you'll get the behavior along the dimension that you want, but because of the stress that this is causing, you might get actually negative responses along other dimensions. And so there's a real case to be made, even when we're thinking about cash and cash transfers, about really thinking long and hard and deep about how conditional we want them to be. And do we rather want to think about a little bit of cash as something that actually opens up the cognitive space to engage with a whole lot of other things that you're otherwise unable to engage to? So all of this is to say that probably more in here than we can talk about right now, but I think that thinking about this intersection between the work on scarcity, scarce mental resources, cognitive load, cash, conditions, other incentives and nudges, and the ways in which we can sort of bring all of this together to design stuff that is effective in the long run and doesn't impose an enormous amount of fiscal strain is, I think, a really important but not yet well-addressed area. There was a question I saw earlier about penalties. I'm trying to scroll up and see if I can find it. I think it was from Maria Bautista asking about penalties and exclusion. And whether penalties could work. And so we talk a lot about incentives and should be talking about penalizing people. It's an interesting question, and I think that I think the discipline has tended to find that negative incentives, it's not that they can't work, but they're kind of a costly way of doing this. And particularly, I think once you recognize that a lot of the things that are getting in the way of things being done are not conscious and are not explicit decisions that people have taken, I think we as a discipline therefore have, with that understanding, and with the understanding as well that financial scarcity and even small reductions in sort of what people have access to can have very large kind of cognitive and social effects. We're very uncomfortable, I think, with the ideas of penalties, which is not to say that they couldn't work in some settings, but I think our instinct tends to be that we know of all these other sort of side effects in some ways of excluding someone or of penalizing them, particularly when they're not doing something consciously. So that's sort of my initial response to that.
So I don't know whether you have any kind of final comments or thoughts, Saugato, that you want to share with the group.
Not really, except to say that I really enjoyed presenting, and it's just this is just an attempt in some ways for us to really sort of think broadly about whether there are interesting problems within the work that people are doing where this kind of approach might be helpful. It's by no means something that is going to be helpful for everything and for all sorts of things. There's a range of things that I think this is not well suited for, but I think there is a range of things for which it is well suited, where it isn't necessarily being used with as much depth as it could be. And at the organization where I work, we're always on the lookout for interesting applications with a lot of with social impact. So for important problems where we can bring this approach to design better interventions. So you can find me on our website. If there is something that you're working on that you'd like to talk to us about, please get in touch. And there's a lot of resources there in terms of things we've written up about projects we worked on and problems we worked on. So it's a good way to find out more. But thank you all very much. Thank you, Annie, and thank you, Sinead, and all the organizers.
Well, thank you very much. I think we've had a great and thought-provoking hour. I certainly kind of have appreciated your insights in the interactions we've had both today and in previous meetings. And I think that sort of the idea of sort of using nudges to help people enact sort of intentions that they may have is really helpful. I also think your comments on sort of cognitive load, particularly for for people in the developing world is really kind of useful to reflect on. So thanks very much.